Hello, and thank you for your interest in becoming a valued volunteer at Giant Steps. To provide you with a brief history, Giant Steps was founded in 1998 on the premise of helping people navigate various disabilities and challenges through equine assisted activities and therapies. Clients with disabilities and conditions such as autism, ADHD, cerebral palsy, Down syndrome, PTSD, and traumatic brain injuries have found immense success and joy participating in the equine assisted activities offered. Giant Steps is a PATH certified facility held to the rigorous standards of care set forth by the organization. The accreditation ensures that all instructors have attended training, education, and certification through PATH. Instructors must also adhere to the ethical principles delineated in the Code of Ethics for PATH certified instructors, which center around professional competency, integrity, honesty, confidentiality, maintaining objectivity, sound judgment, public safety, and compliance. This accreditation also ensures that Giant Steps upholds equine welfare and management standards, providing the horse with a high level of care and ensuring that the horses brought into the program are evaluated and adequately trained to perform safely and efficiently. Exceptional care is also taken to ensure that the client medical and personal information remains confidential and that clients are properly evaluated and reassessed to optimize their therapeutic riding experiences. Horses are used as therapeutic modality to improve client balance, coordination, and strength. The way in which the horse walks produces a three-dimensional movement that transfers to a client's pelvis, spine, and core while riding. The unique relationship clients form with the horses can also lead to increased confidence, patience, and self-esteem. Much like us, these wonderful animals have a unique personality, individualized likes, dislikes, and habits. Giant Steps currently has 14 horses in its care. As you get to know the exceptional equine at Giant Steps, you will find that many of them teach useful skills such as strength, growth, transition, adaptability, communication, humor, loyalty, and kindness, to name a few. Giant Steps offers an array of services, including adaptive riding lessons and hippotherapy, as well as equine facilitated learning and tailored experiences geared towards populations including at-risk youth, military members and their families, and members of the disability community unable to participate in mounted sessions. Adaptive riding is essentially recreational horseback riding for individuals with special needs. Riders learn horsemanship and riding skills in an environment tailored to their individual needs and learning styles. The goals for those in the adaptive riding program are riding skills based, but clients and parents often report many therapeutic benefits of participation. These benefits include improvements of physical strength, balance, coordination, mobility, self-confidence, self-control, peer interaction, and social skills. The term hippotherapy refers to how occupational therapy, physical therapy, and speech-language pathology professionals use evidence-based and practiced clinical reasoning through the purposeful use of equine movement as a therapy tool to engage clients' sensory, neuromotor, and cognitive systems. Equine movements can be a powerful treatment tool and intervention for many. Unlike adaptive riding, these sessions do not teach riding skills. Instead, functional goals are set for the clients to address performance at school or work, the community, and at home. These services are often reimbursable by medical insurance providers, adding an additional benefit for the clients and their family. To provide you with a more detailed example of how hippotherapy is used, let's take a look at equine-assisted occupational therapy. For those of you unfamiliar with the occupational therapy, the term occupation is used in reference to what people do to occupy their time in everyday life. For children, examples of daily occupations include dressing, feeding, playing, and attending school. Occupational therapists provide customized interventions centered around the individual goals to help clients attain greater independence and success in their everyday activities. Common skills frequently targeted during an occupational therapy session include gross and fine motor skills, visual perceptual skills, as well as sensory integration and emotional regulation. Pairing horses with occupational therapy enables therapists to grade the level of sensory input a client receives by varying the horse's gait and maneuvering the horse in a sequence of patterns which alters the client's positioning. Horses provide clients with stabilized, dynamic base of support. Therapists use this to their advantage by having clients reach and bend to place rings around a pole or toss a beanbag into a target to work on increasing the client's balance and strength. Another intervention you may see a therapist do involves having the client place hair clips on the horse's mane. This activity facilitates fine motor development as the client uses grasping and pinching techniques to manipulate the clip. Other interventions include positioning the client backwards on the horse to provide increased vestibular input, while completing multi-step activities promotes increased attention and focus. As you can see, the focus of hippotherapy moves away from teaching horseback riding skills and towards developing functional outcomes. Volunteers are truly the heart and strength at Giant Steps. As a Giant Steps volunteer, you are vital to the success of each individual participating in this program. Giant Steps welcomes volunteers of all abilities, ages 14 and up. Giant Steps volunteers assist in a variety of roles. Depending on the interests and skill sets, they are needed to provide assistance prior to, during, and after sessions. Volunteers are also needed to assist with grounds maintenance and facility development programs as they arise. Special event volunteers assist at promotional and fundraising events, such as the annual Farm Stable Dinner and the Charity Classic Horse Show. Volunteers may also assist with various administrative functions as well. The majority of Giant Steps volunteers provide assistance during adaptive riding lessons and hippotherapy lessons. Volunteers provide assistance prior to and during these sessions under the direction of the instructor or therapist. Many responsibilities include participating in a session by leading the horse, aiding with mounting and dismounting, sidewalking with clients, and assisting the activities during sessions. Volunteers should be committed to a regular, consistent schedule to provide the highest level of care to clients. To ensure the safety of the clients, a predetermined number of volunteers are needed for each class, and each volunteer is counted on to be there during that time. If you are unable to attend your scheduled lesson time, you are running late or need to cancel, please email the volunteer coordinator, Megan, or call the barn as soon as possible so that they can replace you if need to be.
Some of the skills that are required to become a horse handler and leader include having basic understanding of horse safety. You must also be able to independently groom and tack the horse, lead the horse through basic obstacles such as weaving cones, navigating around barrels, and walking over ground poles, in addition to leading the horse on the sensory trail, trotting for short periods of time, and handling the horse in an emergency situation. Horse handlers and leaders are responsible for arriving approximately 30 minutes prior to the beginning of a session to ready the horse. While preparing a horse for a lesson, if you notice anything concerning about the horse, such as cuts, swelling, or lameness, let the instructor know. Each horse has their own labeled grooming boxes with a complete set of brushes, including a curry comb, hard and soft bristle brushes, a hoof pick, and a mane and tail brush. Grooming tools and tack can be found in the tack room near the front entrance of the barn. Appropriate tack will be specified on a daily schedule located in the tack room. Each saddle is numbered. Girth size and the type of saddle pad needed will be listed on the schedule as well. Each horse has their own bridle and type of reins will be specified. Rainbow reins are used most commonly, but some riders may use solid leather reins or ladder reins, which are designed for participants needing a wider grasp. It is important to remember when leading the horse to position yourself on the left side of the horse and to stay positioned between the horse's head and shoulder. This is the safest position for you and gives you the best leverage to steer and control the horse. You will also need to make sure that the lead rope remains attached to the horse's halter throughout the entire session unless the instructor tells you otherwise. Not all clients have the skills to control their own horse independently, so you must always be prepared to adjust the horse's behavior at any time. This includes keeping an eye on your horse's spacing and making adjustments as necessary by halting the horse, leading the horse in a small circle, or changing direction to avoid obstacles or coming too close to another horse. Giant Steps asks that leaders maintain 2 horse lengths between horses at all times. At the start of each session, leaders will bring the horses into the arena to do some warm-up laps in both directions. Leaders must have their tack checked by the instructor prior to the client's mounting, as this is a path standard. Here are some important safety tips to keep in mind. Leaders should tie a knot in the reins and ensure stirrups are docked before leaving the stall and again before leaving the arena at the end of each session. Doing so prevents the reins from slipping and creating a potential tripping hazard and prevents the stirrups from getting caught on stall doors or gates. It is important to hold the lead rope properly at all times as well when leading the horse. The lead rope should be held with the right hand approximately 4 to 12 inches from the metal clasp when attached to the circular ring located at the base of the halter beneath the horse's chin. This allows the horse's head to move freely, minimizing tension in the rope. The left hand holds the remaining part of the lead rope, taking extra care not to coil or wrap the lead rope around your hand. Should the horse become startled or move quickly in any way, your hand could be severely injured if the excess rope is looped around your hand. Mounting and dismounting is directly supervised by the instructor or therapist. Leaders will lead the horse through the mounting area at the beginning of the lesson and hold the horse while their client mounts. The instructor will prompt you when it is time to bring the horse over to the mounting area or to the center of the arena to dismount. A secure mounting platform is used to ensure client safety and the comfort of the horses. The facility also has a ceiling track lift system that provides a safe method of transferring clients that need additional assistance while mounting and dismounting from their horse. This lift system is operated by instructors or therapists only. The role of a sidewalker is to ensure the comfort and safety of clients during sessions. Sidewalkers should arrive to the facility at least 15 minutes before the session is scheduled to start. Sidewalkers assist clients with maintaining posture and balance while mounted. This includes walking or jogging beside the client to provide additional physical support when needed, by performing therapy holds to support the client and improve their stability in the saddle or while engaged in rehabilitative exercises. The various holds and supports will be discussed momentarily. Sidewalkers also assist clients by reinforcing the instructor's directions by providing verbal, visual, or tactile cues to the client. Tapping the client's hand or leg to remind them which one to use, or gently moving the client's hand or arm in the appropriate direction to simulate steering the horse are appropriate examples of cueing a client. Sidewalkers should inform the instructor immediately if the client appears to be coming off balance in any way. If the client shows signs of wanting to get off the horse before the scheduled end time, let the instructor know immediately. Maintain the client's position on the horse until the instructor can assist you and the client. To summarize, the main responsibility of a sidewalker during a lesson or hippotherapy session is to keep the client safe on the horse and provide assistance in the event of an emergency. It is the sidewalker's responsibility to either keep the client on the horse or dismount the client in a safe manner should an emergency situation arise. It is important to remember while sidewalking to stand at the horse's side near the client's knee at all times. This ensures that you are always within reach of the client and not drifting too far to the side or rear of the horse. Instructors and therapists ask that conversations with clients be kept to a minimum. Providing simple verbal cues to reinforce instructions is appropriate, in addition to providing the client with praise and encouragement. After all, sidewalkers do add tremendous value by making the sessions fun for participants. As mentioned previously, sidewalkers provide clients with support while mounted in the form of various lower and upper body holds. The ankle hold provides stability by holding the client's ankle. This provides the least amount of support, but is used to keep the client's leg in place and promotes improved posture and pelvic positioning. Be sure not to pull down on the client's leg or provide excess pressure, as doing so may cause the client to become off balance. If your arm tires or your hand, please notify the instructor and leader to let them know that you would like to switch sides. The arm over thigh hold promotes more stability by holding the client's leg against the saddle or bareback pad. The sidewalker's arm is placed over the client's thigh and their hand should hold the front of the saddle or bareback pad. The weight of the sidewalker's arm while relaxed on the client's leg should be ample enough support to provide the client with the support that they need. If the rider is bouncing in the saddle, gentle pressure may be applied to provide further stability. The thigh and ankle hold provides the most support to the client's lower body. This hold combines the arm over thigh hold and ankle holds. The arm closest to the horse should be used over the thigh, and the arm furthest from the horse is used to stabilize the ankle. Some clients require assistance with stabilizing their upper body to prevent tipping forward or backwards. Trunk stabilization may be used in conjunction with an ankle hold for additional support. Therapeutic and supportive holds should only be performed when prompted by the instructor or therapist, as a primary goal for many clients is to work towards independence and stability. When two sidewalkers are assisting a client, always be sure that you are performing the same hold as the sidewalker on the other side of the horse. Your hold affects not only the client's balance, but also the horse's comfort. It may become tiring to perform a hold throughout an entire session. If your arm or hand becomes tired, again, let the instructor know and they will help you to switch sides. Some clients may be resistant to holds and may push your hand away or try and pull their foot away from your ankle hold. If this happens, let your instructor know and they will determine the best way to move forward. Sidewalkers can assist during mounting and dismounting by aiding on the opposite side of the horse from the client and instructor. During the mounting and dismounting process, you may be asked to hold the stirrup for the client and help guide the client's leg over the back of the saddle. It is a top priority to provide a safe environment at Giant Steps. Working with horses can be a risky activity, and policies have been developed to minimize risk. Safety is everyone's responsibility. If you see anything that you feel is unsafe, please inform the instructor or staff person immediately. Wearing sensible clothing that you don't mind getting dirty, wearing sturdy closed-toe shoes or boots that you can comfortably jog and walk in is essential. Please do not wear sandals, Crocs, or clog-type shoes, short shorts, or dangly jewelry. Please avoid wearing colognes or perfumes, as this can attract insects and many participants have allergies and fragrance sensitivities. An emergency dismount is performed if there's an emergency situation that requires the client to be dismounted immediately. Sidewalkers and/or the instructor are responsible for removing the client from the horse during an emergency dismount. These are performed wherever the horse is at in the arena or while on the sensory trail, as there is no time for the horse to be brought to the middle of the arena. An emergency dismount should only be performed if the instructor calls for one. These are practiced periodically within sessions to familiarize clients and volunteers with the protocol. During an emergency dismount, the horse leader's role is to remain focused on the horse, keeping the horse as still as possible. The sidewalker's role is to make sure that the client is removed from the horse safely. After an emergency dismount, the horse leader's role is to move the horse away from the client, and the sidewalker's role is to stay with the client and follow the instructor's lead to get them to safety. All instructors and therapists are CPR and first aid certified. There are first aid kits located in the barn for both horses and humans. Lastly, Giant Steps has policies in place to protect the confidentiality of participants. Names, specific conditions, or other personal details are held in confidence. To finish this orientation, we will take you through a brief knowledge check. The first question asks, if you are unable to make your scheduled time to volunteer, what should you do? If you answered D, you are correct. If you're unable to make your scheduled time, you should email Megan with advance notice, but if for any reason you need to make a last-minute change or you're running late, please call the barn. Question number 2 asks, which of the supportive holds provides clients with the greatest amount of lower body stability? If you answered C, you are correct. The thigh and ankle hold provides the most amount of lower body stability as it combines the ankle hold and arm over thigh holds. The last question asks, what are the benefits of using horses in therapy? If you answered D, you're correct. Building strength, improving self-esteem, and enhancing quality of life are all key facets to therapeutic riding activities. Thank you again for your interest in becoming a Giant Steps volunteer. The herd is happy to have you.